Hi there, my name is Erin. I'm here to show you how to prepare DAYBUE sticks for your loved one. We'll go through each step to make sure you feel comfortable every time you prepare DAYBUE sticks. Just so you know, you can always find these steps in your starting DAYBUE sticks treatment kit and on daybue.com. Before we start, let's get everything ready. Your doctor's instructions for preparing a dose are included with every prescription delivered from a Novo pharmacy, so be sure to have those handy. You should have your packet or packets of DAYBUE sticks in the measuring device. Using this supplied syringe from a Novo pharmacy helps ensure accuracy. Remember, never use a household measuring cup. From your starting DAYBUE sticks treatment kit, you should also have a mixing cup, mixing spoon, and scissors. If you don't have these on hand, any cup, spoon, or scissors will work. Finally, you'll need cold to room temperature water or one of these water-based beverages, whatever your loved one prefers. All right, we're ready. The dose and preparation instructions are different for everyone, so make sure you follow yours. If you have any questions, you can contact your Novo pharmacist. For demonstration purposes, I'm going to follow this set of instructions. This one calls for 25 milliliters of liquid, so I'm going to draw that in the syringe out of the cup. Make sure to look at it from eye level for an accurate measurement. Now, put the liquid into your mixing cup. Next, we'll combine the sticks packet with the liquid. Since there are no preservatives in DAYBUE sticks, only open the packets right before use. This helps avoid contamination. So for this demo, I'm using one 8,000 milligram packet. Your prescribed dose may require a different strength or more than one packet. Using your scissors, carefully cut along the dotted line and open the packet. Add it to the mixing cup. Make sure you use the entire packet every time. To ensure accuracy, never use a partial packet to prepare a dose. Okay, now you're going to grab the mixing spoon and stir until it's completely dissolved. Now it's time to give them their prescribed dose. Use a syringe to extract the correct amount from the mixing cup and give the prescribed dose right away. Remember, the prepared solution of DAYBUE sticks can be given orally, through a G-tube or a GJ tube, whichever fits your loved one's needs. Finally, any leftover solution should be safely disposed of in the trash can right away. It cannot be kept for a later dose since it doesn't have preservatives. As with most medications, do not pour leftover DAYBUE sticks solution down the sink or toilet to avoid putting it into the water system. Remember to store them at room temperature. DAYBUE sticks packets do not need to be refrigerated, so you have the flexibility to bring them with you on the go. If you have any questions, don't hesitate to reach out to your doctor, your Novo pharmacist, or your family support educator.
What is DAYBUE or DAYBUE sticks? DAYBUE or DAYBUE sticks are prescription medicines used to treat Rett syndrome in adults and children 2 years of age and older. It is not known if DAYBUE or DAYBUE sticks is safe and effective in children under 2 years of age. Important safety information. What are the possible side effects of DAYBUE or DAYBUE sticks? Diarrhea. Diarrhea is a common side effect of DAYBUE or DAYBUE sticks that can sometimes be severe. Diarrhea may cause you to lose too much water from your body, dehydration. Before starting treatment with DAYBUE or DAYBUE sticks, stop taking laxatives. Tell your healthcare provider if you have diarrhea while taking DAYBUE or DAYBUE sticks. Your healthcare provider may ask you to increase the amount you drink or take anti-diarrheal medicine as needed. Vomiting. Vomiting is a common side effect of DAYBUE or DAYBUE sticks. Sometimes vomit can get into your lungs, aspiration, which could cause an infection, aspiration pneumonia. Tell your healthcare provider if you have severe vomiting or if vomiting happens often. Weight loss. DAYBUE or DAYBUE sticks can cause weight loss. Tell your healthcare provider if you notice you are losing weight at any time during treatment with DAYBUE or DAYBUE sticks. The most common side effects of DAYBUE or DAYBUE sticks include diarrhea and vomiting. Other side effects include fever, seizure, anxiety, decreased appetite, tiredness, and the common cold. These are not all the possible side effects of DAYBUE or DAYBUE sticks. Tell your healthcare provider if you have any side effects that bother you or do not go away. What should I tell my healthcare provider before taking DAYBUE or DAYBUE sticks? Before taking DAYBUE or DAYBUE sticks, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, are pregnant, or plan to become pregnant. It is not known if DAYBUE or DAYBUE STIX will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if DAYBUE or DAYBUE STIX passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby while taking DAYBUE or DAYBUE STIX. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking DAYBUE or DAYBUE STIX with certain medicines may affect how the other medicines work and can cause serious side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also call Acadia Pharmaceuticals Inc. at 1-844-4-ACADIA, 1-844-422-2342. DAYBUE is available as an oral solution, 200 milligrams per milliliter. DAYBUE STIX for oral solution powder is available in 5,000 milligrams, 6,000 milligrams, and 8,000 milligram packets. The risk information provided here is not comprehensive. To learn more, talk with your healthcare provider and read the accompanying patient information. Visit daybue.com for the full prescribing information.